It's a shocking statistic. In Canada, someone suffers a stroke every 10 minutes. For many of these events, which affect the brain, lead to serious disability that can include a condition known as focal spasticity. Spasticity is a neurological condition characterized by an abnormal increase or hyperactivity in muscle tone. But there is hope. Treatment options are available to help individuals with spasticity regain their quality of life. Joelle Cooper was struck down by a stroke in the prime of her life and has been living with spasticity ever since.
I had a stroke when I was 15 years old and was paralyzed on my left side completely. I wasn't expected to live or walk or, quite frankly, be able to think again, so I beat the odds there.
Symptoms of spasticity can vary from mild stiffness to severe uncontrollable muscle spasms that can be very painful, especially if joints are pulled into abnormal positions or otherwise can prevent normal range of motion. The condition can interfere with movement, balance, walking, and other mobility, and the ability to perform a range of daily activities. Left untreated, affected muscles are subject to contracture, a condition that leaves the muscles and tendons permanently shortened and can result in a permanent, often painful, abnormal posture. Dr. Satyendra Sharma specializes in the treatment of spasticity and other movement disorders.
If spasticity is not controlled, it can lead to more serious complications such as skin breakdown. Spasticity can also cause pain. There are hygiene issues depending on where the spasticity is, so in the proximal part of the limb.
Therapeutic treatment options such as Botox, a specific form of botulinum toxin type A, help to reduce the stiffness, muscle spasms, and other symptoms that spasticity causes and promote independent functioning of the muscles themselves.
The first symptom that patients notice is the release of the muscle stiffness. And often muscle stiffness is accompanied with pain, and therefore pain is relieved as well. So these are the first two things which patients notice, and then it makes it a lot easier for the therapist to start working with them, and the therapy becomes more effective, which patients after some time start noticing an improvement in the function as well. I've been very pleased with the use of botulinum toxin. Actually, I feel that Botox is the first-line treatment in spasticity management.
I would say that now I certainly am back to having a lot more energy. Walking is much easier. I'm much more able to engage in the activities that I enjoy, and spending time with people and not thinking, okay, well, I have to go home from work and basically get ready for bed because I'm so tired because I was in pain all the time. So much better.
Treatment exists for people living with focal spasticity, which can have a very positive impact. Botox has been available to these patients since its approval in Canada for the management of focal spasticity in October 2001. Its safety and efficacy have been well established in clinical trials and further supported through real-life patient experience. Since its first approval in Canada 20 years ago, serious adverse events, whether or not considered to be related to Botox, have been reported rarely and vary by treatment indication. For more information about focal spasticity and to better understand your treatment options, along with their specific risk-benefit profile, speak with your physician. Sherry Demetarco reporting.